In 2013, West Africa was first affected by the Ebola virus. The epidemic began in Guinea and then spread rapidly to Liberia and Sierra Leone, countries with health systems already weakened by poverty and conflict. The late response to the epidemic, which resulted in over 11,000 deaths, not only highlighted the shortcomings of health systems in the region, but also the need to strengthen them to detect and respond more efficiently to this kind of disaster. A situation that calls on governments and their partners to coordinate national and regional initiatives to address the health challenges facing the continent. It is within this framework that HHA, the Harmonization for Health in Africa, conducted in 2016 an independent review of its 10 years of activities.
During the last, I would say 10 years, the global health landscape is evolving very rapidly. And we all realize the need for more coordinated and harmonized actions, especially in the area of health system strengthening, which is a very crowded field. Many partners are engaged. HHA is a platform at the regional level in Africa, which helps different organizations come together, harmonize their activities, and work on countries' health system strengthening jointly. There are structured partnership platforms for other areas of health, like HIV/AIDS, tuberculosis, malaria, maternal and child health. In health system strengthening, we do not have a common global coordination mechanism. There is a process of establishing one now under the WHO, but HHA is a complementary to that because this is specifically focused on Africa, and Africa is the most important region in global health.
C'est un mécanisme qui réunit.
It is a mechanism that brings together the major partners in the field of health and who want to discuss on how to achieve the maximum results with the action of each one of us, who would go in the same direction to pursue the same objectives, with all the complementarity and effectiveness possible so that we make the same difference in the various countries of Africa.
En octobre 2016, nos experts se sont réunis pour
I think that in October 2016, our experts did come together to review progress accomplished in terms of the harmonization of health intervention in Africa. These recommendations focused on governance issues, coordination issues to ensure that the goals set for 2006 can be achieved. So our session here in Dakar will enable us at the level of the regional directors to agree on the reforms that must be carried out to ensure that in this rather special period, where we want to accelerate the realization of the objectives of sustainable development in a context marked by the rise of nationalism, but also by the scarcity of resources and the multiplicity of stakeholders. We believe that it is really appropriate to meet here in Dakar, but above all to take a certain number of decisions which will enable us to move forward and respond to the concerns of countries in the south of the Sahara.
The results of this review and the review of the current health situation in the region were presented at the 9th meeting of the regional directors of the HHA mechanism, recently held in Dakar, with the participation of 11 of the 16-member institutions. The meeting, hosted by the UNFPA Regional Office for West and Central Africa in the Senegalese capital, examined the new strategic directions of the mechanism to improve the support to countries and ensure better living conditions for the populations in the context of the African Union Sustainable Development Goals and the Agenda 2063.
Nous avons également convenu d'avoir un nombre limité.
We have agreed on a limited number of interventions, but strategic interventions that are able to add value at the country level to achieve efficiency and effectiveness in the way, but also in what we are doing at the level of all countries. For example, we talked about improving absorptive capacity. We discussed how we can make sure that in the countries where there are very few resources, what we can do as a platform to help these countries move forward so that our work work does not leave anyone behind, so that the 2030 development agenda can find a programmatic but real pragmatic interpretation on the field. We also discussed how to ensure the containment of the proliferation of new initiatives across the continent. We also discussed how our platform can accompany major African initiatives such as the Maputo Action Plan, the agenda that focuses on the demographic dividend, but also other agendas that are at the heart of the concerns of the highest authorities of the African continent.
Today's discussion was about how to revitalize. We even talked about resuscitating the mechanism to make a difference. So this new vision, we articulated very clearly. First objective, results. It's not coordinating just to coordinate. It's about making a difference. Second fundamental principle, primacy, the importance within the country level. We are here at the service of the ministries of health of different countries to help them translate their visions into reality. It is a support mechanism that is there to help, but not to substitute, not to duplicate itself, to have its own agenda. At the meeting, special attention was paid to improving the governance structures of the HHA mechanism and building the capacity of its secretariat based in Brazzaville at the headquarters of the WHO Regional Office for Africa. In order to better align the mechanism's actions with national priorities, the CSU, universal health coverage, and mobilization of resources for the effective implementation of the HHA 2017-2019 action plan were also on the agenda.
For us, the structural change will really be the strengthening of the Secretariat. For once, we have agreed that WHO will be the chair of the whole Secretariat. But when we have meetings and when we have things that need to be done, they will co-chair with one of the partner agencies, maybe on a rotational basis. So that's basically that. It's really the strengthening of that Secretariat and at least now know where the accountability is going to be and making sure that we put resources towards the Secretariat to be able to coordinate it at country level. But in the ultimate, each one of us as regional directors in our own mandate are really responsible for that coordination. For example, somebody like me, one of the things for me is gender equality. And I was able to actually take all our regional directors and go to a country such as Malawi to say, let's see what we can do to work with communities in ending child marriages. We were able to do that, and right now Malawi has a law that prohibits marriage to anybody under 18. So that's part of HHA, and those are the kind of collaborations that we need, because we've seen that when we are united, we can be able to get into a country, work with the partners, especially the traditional leaders in this case, and we're able to achieve that result.
At the meeting, HHA regional directors renewed their commitment and stressed the need for harmonization, effectiveness, and accountability that should guide country support. In the current context of scarcity of financial resources, they recalled the need to meet the challenges to accelerate progress in health, an essential factor for economic and social development. We have tried to prioritize what we're going to do in terms of strategic actions. For example, we're working in the health system to support capacity building at the country level, but we felt that the most important thing is that the WHO health system is better funded. So we will put all our efforts together to support the Minister of Health to make much more progress by mobilizing resources, for example, from the finance minister of our countries.
HHA, the contribution, the most important contribution will be to ensure that those agendas are actually implemented. You know, one of the things we are famous for as Africans is that we make these huge and really great policies, but then they are not implemented. So that HHA will be working with Israel to say, let's all work towards implementation of Agenda 2030 and all the continental the declarations that our leaders have been able to make. So it's really to coordinate. We are not even going to be implementing ourselves, but to ensure that those who are implementing are having a coherence. And you don't have, for example, donors who say we are going to work only in the capital city. And we're saying, but the need is actually in the rural areas, particularly rural area, this. So we're going to be helping also with provision of strategic information, because sometimes people act without really knowing what their priorities should be. So for each one country, we should be able to come with a strategic information that the politicians can even have a say to say, for us, we are going to work with our partners in writing this or doing something else, but based on actual evidence.
HHA member institutions have adopted a number of guidelines and decisions to strengthen support for the implementation of the African Health Strategy and the African Union Agenda 2063. A roadmap has been developed for the joint implementation of the guidelines and decisions taken by the regional directors. Dakar marked the transformation of the HHA mechanism, enriched by considerable prospects.